Hello, and welcome to the presentation of Team Healthy Karma. Our team members are Nicole Bennett, Nicole Beiser, Laronia Burnett, Shanice Herx, Tarita Skurlock, and Sam Eunice. Today, we will discuss healthcare workers in long-term care facilities and the flu. Influenza poses a threat to a number of individuals and groups. Of those most susceptible to the threat of influenza are elderly people aged 65 and older. The Center for Disease Control states that approximately 70 to 90% of seasonal flu-related deaths occurred in this age group. A factor that has contributed to the skyrocketing number is healthcare workers in long-term care facilities not being vaccinated, specifically certified nursing assistants. With only 67% of healthcare workers in these types of facilities vaccinated, CNAs continue to have the lowest rate of vaccinations. Our literature review results show that vaccination coverage among healthcare personnel working in long-term care settings, mainly those who worked as assistants and aides, continuously to be consistently lower than that among healthcare personnel working in all other healthcare settings. The lack of vaccination poses a grave threat to the elderly population in these facilities, as these patients are generally not vaccinated themselves due to compromised immune systems and other health-related issues. The research from these reviews also showed that implementing workplace vaccine programs that have been shown to be beneficial in other healthcare settings can help increase the coverage of vaccination in long-term care facility employees, especially certified nursing assistants. Some factors that influence whether or not healthcare workers receive flu vaccinations were fear of an increased adverse side effect of the vaccination, lack of time available to commute for a vaccination administration, increased cost of the vaccination, lack of knowledge of how the vaccination works, their own fear of needles, and also religious beliefs.
Thank you, Tarita. This is Nicole Bennett with Team Karma. Our research question is, why are certified nursing assistants, CNAs, in long-term care facilities not receiving the flu vaccination? Through our literature review, we found that we would like to identify the reason why certified nursing assistants do not receive the flu vaccination. We can use this data to create health promotion campaigns focusing on decreasing the vaccination stigma in certified nursing assistants as well as other healthcare professions. Our target population, or population of interest, is certified nursing assistants, CNAs, that work at long-term care facilities. We define long-term care facilities for the purpose of this study as skilled nursing facilities. We're using skilled nursing facilities, or SNFs, as a way to gauge this sector. Skilled nursing facilities are defined as a healthcare institution that meets federal criteria for Medicaid and Medicare reimbursement for nursing care. We decided to use an observational study with a cross-sectional design. This type of study analyzes data from a specific population or a representative subset at a specific point in time. The data collection tool used will be a survey, as well as an interview and focus groups. The reason our team chose the study design is there is a low or no attrition rate. It is inexpensive, and we can measure the data at one point in time across a large population. A weakness of the cross-sectional study design is that it does not determine cause and effect, and it is also vulnerable to selection bias. For our sampling approach, we decided to use a convenient sampling method. How we decided to use this method was through two different public data source bases that we were able to find online. The first data source base we were able to use is SunCal Health Contracted Provider Network, which is available at www.suncalhealth.org. This network identifies 19 skilled nursing facilities in San Luis Obispo and Santa Barbara counties of California. We've also identified 16 skilled nursing facilities using the Medicare Provider Aggregate Table data set derived from claims data published by Center for Medicare and Medicaid. Together, we have identified 35 skilled nursing facilities in the San Luis Obispo and Santa Barbara counties. We will use these skilled nursing facilities to identify certified nursing assistants through a quantitative survey. The quantitative survey will go out to all of the healthcare workers in the facilities, and we have identified a question asking if the healthcare worker is a certified nursing assistant as the first question. If the worker is not a certified nursing assistant, then they have completed the assessment. If the participant is a certified nursing assistant, then they would be prompted to answer the rest of the questions on the quantitative survey. The quantitative survey also will ask questions if the participant would like to further participate in the qualitative study, and we will set up interviews through contact information listed on this quantitative survey. Then we will also set up focus groups from this information as well.
Thank you, Nicole. My name is Shanice Herks, and I will be addressing qualitative data collection methods and values. For qualitative data collection, Team Karma chose to use collective methods that will not only address social determinants, but address individual and group influences such as perceived risk and awareness, and trust and knowledge in the healthcare system. Team Karma's selection of specific survey questions from the SAGE working group allows us to uncover the root cause of vaccine hesitancy among long-term care facility workers. In addition, our use of the Likert scale requires participants to answer their level of agreement to a statement. The use of qualitative data is valuable to our work because it not only helps us to understand healthcare workers' attitudes towards the influenza vaccine, but also helps us to assess possible ways to fill the gap, to encourage certified nursing assistants to get vaccinated, to provide reliable information, and to potentially predict future immunization trends in long-term care facilities.
Approaches used to gather qualitative data. The approach we selected in order to collect our qualitative data will be conducted via face-to-face with small groups using semi-structured interview questions. This style will effectively allow us to pick up on inflections and hesitations in interviewees' voices, as well as monitor body language. By doing so, we can proceed with follow-up questions. Methods of collecting are as follows: phone interviews that have been pre-recorded and transcribed, one-to-one interviews, and focus groups, all of which will be utilizing open-ended questions. Interview guide. In order to recruit CNAs for our focus groups, we will reach out to the facility administrator to obtain permission to conduct the study and recruit their CNAs. By doing so, we can obtain the company's directory. From there, all CNAs will be invited to participate in a luncheon provided by us and will be briefed on our research purpose. Once recruited, we will proceed with the interview process.
Application type, expedited review. This study is in accordance with Federal Regulation 45 CRF 46101, B2 and B3. It presents minimal risks, research on individual or group, characteristics or behavior, or research employing survey, interview, or oral history, focus group, program evaluation, human factors evaluation, or quality assurance methodologies. Study instruments. During the course of this research, we will be using both qualitative and quantitative questions. What are qualitative and quantitative questions, and what are their respective purposes? In short, quantitative questions tell us what a participant is doing, and qualitative questions give us further insight as to the reasoning behind their beliefs and actions. These types of questions may be administered via paper or electronic survey, during phone interviews, or during live focus groups. Some quantitative questions that may be asked are the following. Are you a CNA? How old are you? How long have you been a CNA? How many facilities have you worked at? Would you like to participate further in this study through a phone interview? What is a contact phone number if you would like to participate in a phone interview? Would you like to participate further in this study through a focus group? What is your contact email and phone number if you would like to participate in a focus group? Some qualitative questions are, how do you feel about the flu vaccination? Do you believe you can get the flu from the flu vaccination? Why or why not? Tell me why you don't trust the flu vaccination. Only use if trust is the reason for refusal. Does whether or not your company pay for the flu vaccine influence your decision? How? Do you feel your religion discourages vaccinations? Why or why not? If there was an alternative vaccination to the flu shot, how would you feel about receiving it? Are you familiar with herd immunity? Please define herd immunity. How do you feel receiving the flu shot will help your patients? How do you feel the flu vaccination may harm your patient? Do you feel that receiving the flu shot aligns with your ethical codes as a healthcare provider? How does the media influence your decision to get the flu shot? Have you had negative vaccination reactions or experiences in the past? If so, what were they? If you indicated that you have worked at other facilities in the past, did they have different policies regarding workers being vaccinated against the flu? If yes, please explain. These types of questions will help us identify the population we wish to target and gain information about their thought processes and reasoning behind their decisions. Privacy safeguards. While conducting research studies, it is important that participants be protected. Respect for the participants' autonomy means allowing their opinions and choices while refraining to obstruct their actions. Benefits. Treat participants in an ethical manner by respecting their decisions and guarding them from harm. While conducting the study, it is important to minimize any harm and maximize any benefits that may be incurred upon the participants. Justice. Just as the principle of respect for persons finds expression in the requirements for consent, and the principle of benefits in risk or benefit assessment, the principle of justice gives rise to moral requirements that there be fair procedures and outcomes in the selection of research subjects. It is also important to identify any vulnerable populations. And it is also important before beginning any research study that informed consent be obtained. Informed consent. What exactly is informed consent? Informed consent states that a person enrolling in the research study is voluntarily agreeing to take part in a research study. It is a process in which the research participant has an understanding of the research study and if any risks that may arise during the course of the study. It is obtained well before the participant enrolls in the study. In order to obtain informed consent, the study facilitators must inform the participants about their rights, the purpose of the research study, what to expect during the course of the study, including, if any procedures, if any potential risks or benefits that may be incurred during the length of the study. Informed consent also protects participants from being asked to release or absolving the study administrators or affiliates from liability for any negligence. The objective of informed consent process is to provide sufficient information so that prospective participants can decide if they wish to take part in the study. It must be written using unambiguous language, making it easily understood while minimizing any possibility of coercion or undue influence. The participants must also be given ample amount of time to decide whether or not they would like to take part in the study.